I was a medical student in Bristol, and the first time I came to Bristol, I stepped off the train just up the road, and I went to Bristol University, and that was in 1976. And in 1976, I was taught how to have conversations with patients. And in 1976, those conversations were interrogations, really. We weren't really interested in patients' beliefs or preferences or understanding of their health. We weren't interested in giving them control. We were interested in their diagnosis so we could try and fix them. That was a long time ago, but I think there are still remnants of that way of being in the way we teach medical students, even in the 21st century. Because many of us as doctors are trained to be diagnosticians and expert fixers. But I think those of us in this room know that actually the century of the expert fixer was last century. And we're now in the 21st century, where I think doctors in particular ought to be generating, using, practicing a very, very different set of skills to those which we were given, well, in my case, in 1976 and 1977. Because it's all about the conversations that we have, isn't it? It's really all about the kind of conversations that we have. It's about trust. It's about empathy. And it's about what Carl Rogers called unconditional positive regard. And I use those three words when I teach medical students nowadays. How difficult it is actually to have unconditional positive regard when we're in conversation with someone. Even when we're in conversation with our loved ones, perhaps even more importantly, when we're in conversation with our loved ones, it's difficult to have unconditional positive regard. But if we can nurture that in ourselves and bring it to the conversations that we all have, actually not just with people who live with long-term conditions, but people who live with disability, but in the conversations we have with each other. And that's what I've really noticed today, actually. I've spent some time just wandering around the stalls, and it feels to me that we're all nurturing unconditional positive regard for each other, and it's a really lovely, warm feeling, I've got to say. So thank you for inviting me. In the Health Foundation, we have thought a lot about what the skills of a 21st century professional might be, and what the principles of person-centred care are. We've written quite a lot about it. It's gone into the way National Voices thinks and the way that NHS England thinks. We believe it's about compassion. We believe it's about coordination. We believe it's about personalisation. And we believe it's about enablement. So compassionate, personalised, coordinated and enabling services. What it really just comes down to, again, is the conversation. And the conversation is about not what's the matter with you, but what matters to you. The conversations aren't about what can't you do. The conversations are about what can you do? What would you like to do? What can we do to support you to move forward in your life? So my message is, it's about relationships. It's about conversations. It's about using all of our assets together. But I know that's what you're already doing. I've been humbled by listening to so many people here today doing such wonderful, wonderful work. So keep going, keep moving forward, enjoy the rest of your afternoon, and it's an absolute pleasure and privilege to be here. Thank you.